is Melissa Ayala, and I am the director of the Acute Treatment Unit, as well as Recovery Solutions, and oversee the Suicide Prevention Coalition. There's such a stigma surrounding mental health, and it's so necessary for our overall well-being. I am a big advocate for wellness in general, and if you don't have wellness in the mind, you can't be physically well either. So I have always been fascinated by how we can help to get our mind well in order for the rest of us to be well, from a physical, emotional, psychological standpoint. And so I enjoy helping people. I really enjoy seeing that transformation, especially from an inpatient setting. You see it fairly quickly, where people improve substantially prior to when they were first admitted. So from admission to discharge, you see a substantial growth in just their overall well-being, and that's really, really special to see. And I also enjoy supporting our staff in those endeavors. We have a wonderful staff who supports our clients, and I take great pride in the care that they provide. So working with the Suicide Prevention Coalition, we work really closely just with community organizations. It's a community-based program, so it's not just Health Solutions that operates through the Suicide Prevention Coalition. We have a lot of different agencies that help support us through the coalition, and it's community-based. And so as we're out in the community, we see a lot of individuals who just have these myths about suicide and about talking about suicide. One of the biggest ones we often see is that, well, if we talk about it, it may influence that individual to actually carry out a suicide. And that is a huge misconception. We know that most people just want to be heard, and if someone would just take the time to listen to them and support them, they want that help, and they don't want to feel the way they feel. And so that's probably the biggest misconception surrounding suicide specifically, is that people don't want to talk about it because they feel like if they talk about it, it may influence that individual or put those thoughts in their head, and that is absolutely untrue. And so we're out there in the community hoping to prevent that misconception and getting people to actually talk and engage in those conversations. And obviously we have the inpatient unit, so when individuals are struggling in a significant way, we want to support them through having them come into a safe place where they feel safe, where they get supports, they're getting therapeutic interventions as far as group dynamics, they're getting medication management. We have a psychologist on staff at our ATU, so they're getting full psychological assessments during that process, and getting some tools and skills that they can use as soon as they walk out the door from the ATU. We also have a discharge planner there who does discharge planning with clients, so it could range from anything from an ACF placement to getting them resources to making sure they have therapy and case management and medication management on an outpatient basis. So those are all services that we provide. And then over at Recovery Solutions, it's a drop-in center, so clients can go there any time of the day and they can drop in, and they may be able to attend a group. We have sewing classes, we have skills groups, we have cooking classes, and it's really community engagement. It's about people who feel like they don't belong coming into Recovery Solutions and having a place where they do belong. And so if you have a chance to go over to Recovery Solutions, it's really cool just to sit back and watch those people engage with one another and feel that connectedness that they all share through that drop-in center.